Hello, everyone, and welcome back to the Office of Community Outreach and Engagement's video series. Today, we're going to be having a pretty interesting conversation and one that I personally do not know a lot about. We're going to be talking about rural hygiene and medical poverty as it relates to rural communities. And to help us out, I have a very special guest with me. I have Ms. Bethany Osgood. Bethany, thank you so much for being here.
Thank you for having me. I'm really excited, Dylan, to have this conversation with you.
Bethany Osgood is the current president of the Washington State Rural Health Association. She's the development director of Project Beauty Share, which she'll explain more about. Bethany has more than 20 years experience working in social and health services management. She is a retired firefighter and EMT worker. Bethany moved to Spokane in 2009 to explore her passion in social services, teaching, and rural health care management. And she holds a special place in her heart for women, children, and families in recovery, overcoming poverty, and supports their journey to find joy, dignity, and healing. So with that said, Bethany, you ready to get started?
Let's do this.
Okay, let's do it then. Describe to us what rural hygiene and medical poverty is.
That's a really great question, and it's so in depth. When we talk about poverty, what comes to mind immediately for people is homelessness or people living on the streets, people displaced by unemployment and things like that. Then we narrow down and we really focus on rural poverty, rural medical poverty, rural hygiene poverty. This is about a geographic or spatial location that creates barriers or obstacles to people trying to get medical care, food insecurities, or hygiene supplies. Not only does the poverty level increase in the rural communities, but the barriers increase, such as lack of transportation, lack of emergency medical care, lack of ability to see a provider for preventive health measures. We're talking about recruitment in rural health areas, keeping people with higher education levels. So it's a joint kind of problem or barrier living in rural communities, especially during the COVID pandemic, because we're seeing more and more people displaced, more and more people in rural communities cut off or having additional barriers to access to healthy foods, medical care, job security. And with our schools shutting down, the children are starting to experience social distancing from their friends and their social networks, the lack of having those 1 to 2 to 3 meals that they're getting at school, transportation, and then the higher education levels.
Does this impact emergency medical services in rural areas? And if so, how?
Well, let's talk about that. So when you're living in a rural community, I did a little bit of research, and roughly 9.8% of Washingtonians are living at or below the poverty level. Just above the poverty level is roughly another 15%. So we're looking at 30% of 7.17 million people, roughly 1.7 million people in Washington are experiencing at or below federal poverty level. That means that their income is so low that they're needing food stamps, they're needing the federal food assistance, they're needing hygiene, they're needing social services more than ever. And this is starting to take a toll in rural emergency medicine. When I did an interview with Deer Park Rural Ambulance or Volunteer Ambulance Company, they're starting to see increases in calls in abdominal pain. They go out, it's an elderly person or a person with abdominal pain times 3 days, the emergency response, they go into the home and come to find out there's abdominal pain because the person hasn't eaten properly or has run out of food. So now they're calling the emergency services, they're tying up a paramedic unit for abdominal pain. They're starting to launch a community paramedicine program, the people that they know in their community that are calling because of abdominal pain. They're going to show up now with a food box and a box of hygiene products for families. Their dental calls are starting to go through the roof. People are calling in with abscess or infections in their mouth. And they're tying up yet another paramedicine unit for something that could have been prevented. toothbrush, toothpaste, regular oral hygiene, seeing the dentist. That's not happening because the children usually access oral hygiene through their schools and through their dental visits. So now that is another barrier. Rural EMS response is starting to change from your car accidents, your farming accidents, and they're doing more community paramedicine programs and coming into the homes and finding lack of food, lack of resources. People are waiting till they're sicker, and they're waiting longer and longer for those preventative health appointments. And now they're calling the ambulance because their heart disease is out of control, their blood pressure is out of control, diabetes. We're also seeing that vital interventions for chemotherapy for cancer patients, interventions for high blood pressure, heart disease, wound care is being delayed or denied completely because of the COVID pandemic. And people are seeing that I have to wait 3, 6, 12 months to get care. So now they're sicker and they're calling their rural EMS provider to come and take care of them. So we're doing more in-home visits and in-home care as rural paramedicine programs.
What are you most proud of with the Washington State Rural Health Association and Project Beauty Share?
I love that question. I love that question. So we're going to turn it a little bit personal. I have a couple of props here that I'm going to show us. Sorry if I'm reaching around and causing chaos. I'm a recipient of Project Beauty Share. We've been in existence since 2010, and it was the brainchild of Julie Farley, our founder and executive director. And we were finding that many people were subscribing to beauty boxes, or they'd try a shampoo, they'd use it once and they didn't like it. And people were throwing these items away. In addition, it became really apparent with the Federal Food Assistance Program, AKA SNAP, or food, kind of the old food stamp model. They don't pay for soap, shampoo, conditioner, deodorant, toothpaste, toothbrushes. And so Julie, at the bottom of her heart, started this program in her makeup studio, collecting these gently used cosmetics and hygiene supplies. And then she would reach out to her local social service agencies and say, hey, you guys need these, come on and pick them up. And that started with 1 or 2 agencies. And now I'm so proud of Project Beauty Share. We have 132 registered nonprofit agencies in the Inland Northwest, and we have 15 national sites across the United States that receive product from us. We were last year able to receive, recycle, clean, sort, sanitize, repackage 80,000 pounds of gently used cosmetic and hygiene supplies, and then distribute those out. That's the equivalent of $4.1 million that people did not have to spend their own money on, or their life support checks or their unemployment checks on these products. So I was a recipient. What a lot of people don't know is now I'm a professional woman. I have a college education. I have a wonderful career, 20 years experience, an amazing family. I'm so supportive, and my community is so supportive. But there was a time when I was a survivor of domestic violence. There was a time when I had to come to Washington to restart my life. And I happened to be at another one of our agencies, and they gave me this wonderful little bag like this. And I opened it up, and I'm not really a makeup wearer because I'm kind of a tomboy, but I opened it up and there was this little thing of lip gloss in there, and I opened it up and I smelled it, and it smelled so wonderful, and I put it on. And the smallest things make us feel renewed, gives us a sense of hope, a sense of dignity, a sense of I'm beautiful. And everybody, we believe at Project Beauty Share and Washington Rural Health Association, deserves to feel clean, feel beautiful, know that they're cared for. And we do amazing things. So at Project Beauty Share, we put these wonderful bags together. You know, they have vitamins, deodorant, feminine hygiene products, cosmetics. We put in soap, shampoo, body wash, all sorts of wonderful items for men, for women, for children. because they deserve to feel clean, to be clean, to feel beautiful, to feel loved. And when people are feeling healthy, their mental health, their mood changes, and they become more productive. They feel that they can engage in school, their job, society. They feel important. And that's at the heart of what Project Beauty Share does. At the same turn, with the Washington Rural Health Association, we really bring a spotlight to rural health. Rural health has a special place in my heart because I grew up in Walla Walla, Washington. Rural as it gets. We stood in line for the penny can sales, so for the dented can sales, so we could bring food home every month. And being in rural communities, we are a tight-knit group. We love each other, we support each other. We'll hold spaghetti dinners for the family that lost a home. We're incredible, resilient people, but we have also obstacles. And I'd like to share a couple of those that Washington Rural Health Association has really championed. Is rural health poverty and medical poverty in rural communities is not only a geographic problem, it's a spatial inequality. That spatial inequality is barriers to, we used to have vans that would come and bring people to their doctor's appointments and dental appointments, social service appointments. With the pandemic, that had to stop because we could not take the risk of exposing people. Now I don't have a ride to my doctor's appointment, and my disease state might advance. So then it goes back to, I'm calling the ambulance for my abdominal pain or tooth abscess. Rural Health of Washington really focuses on, we need to reduce those higher mortality rates. We need to lower the disease state. We need to focus on preventative healthcare in the rural communities. And that's so important through education. It's super important that we need to know that Pend Oreille County, Ferry, Omak, Assotin are some of the hardest hit counties in Washington state. They actually show up red as the most impoverished counties on our national poverty federal line when you go to the Office of Financial Management. We need to know that when schools are closed, children are not getting their healthy meals. So what can we do as a community? We empower Deer Park Ambulance to do the community paramedicine program. They deliver fresh fruits and vegetables and hygiene products. What I'm so proud of with the Washington Rural Health Association as well is that we're bringing to light that there cannot be that delay in treatment, especially for rural communities. We need to make it more appealing for physicians and providers and social service agencies to be alive, well, and active in those communities.
How can we make a difference?
First things first is, I believe that the pandemic has caused that spatial barrier. So we are feeling maybe disconnected, a little bit alone, a little bit removed from our community, from our friends, from our family. The first thing I would love to see everybody do is get on your phone, get on your computer, call somebody today and say, I'm just thinking of you, Dylan. Man, I'm so proud of you. I love you. You're doing such amazing things at Fred Hutch. Like just that small act of kindness. I'm a huge believer in kindness. I'm a huge believer in giving back. The second thing is how to get involved. You can go on the Project Beauty Share website, social media, Instagram, YouTube, Facebook, what have you. Is so important that rather than throwing away your partially used items, you can put those in a box and donate those to Project Beauty Share. We're the only organization that we know of in the United States that can take gently used cosmetics and these products. And we have a system where we can sort, sanitize, clean, package, and deliver those right into the hands of people that need them across the inland Northwest, across the United States. The other thing is, as you may know, research and operations make the ship move forward. So important. Fred Hutch always needs those research dollars to provide treatments, to provide cures. Same thing with Washington Rural Health Association and Project Beauty Share and Deer Park Volunteer Ambulance and all of those agencies out there. They could use your operational dollars for as little as $5 a month, one mocha, one latte. By the way, I had one today. You can give up that $5 and give that money for an operational cost to your favorite charity, your favorite social service agency, your favorite research institute, Project Beauty Share. Super important that what little we have, let's give back to those communities. If you live in a rural community, reach out, start blessing somebody, get involved. Your voice is the most powerful thing that you can use to call attention. So rural health poverty is really quite unique because it's not religion based, it's not ethnicity based, it's not sexual orientation based, it's geographic based. It's based on that zip code. And according to the Spokane Regional Health Department, each zip code has a life expectancy, and that can vary up to 20 years depending where your zip code is. So go to your neighboring zip code, help them out just a little bit.
Restoring dignity and spatial inequities. I think those are going to be my biggest takeaways today and something I'm going to think on. And for our viewers at home, I wonder what yours will be. Bethany, I want to thank you so much for your time. This wraps up our questions for today. However, if you are interested in more information about Project Beauty Share, about the Rural Health Association, and about medical poverty and rural hygiene, we'll have links established to this video. Bethany, last words?
Absolutely. I have a couple of last words for you. And for our audience out there is restoring hope and dignity. It goes back to our very basic needs as us as human beings. It could be as simple as a smile. I remember I was having a really rough day and I was kind of praying up to the universe and talking. And I was just like, I would just love to see one person that knows me that would smile. Within about 3 minutes of walking through the grocery store, somebody I hadn't seen in like 5 years walked right up to me and said, Bethany, it's so good to see you. You look beautiful. And she gave me a hug before the pandemic, which just turned my whole day around. Open a door. Understand about rural poverty and hygiene poverty, medical poverty, and that spatial inequity. Understand that hope and dignity takes one action today. And that one action I'm going to bestow on you. And I'm going to smile at you and say, Dylan, what a blessing to be interviewed. What a blessing to give me this time to share with all of you the amazing, wonderful things that Project Beauty Share, Washington Rural Health Association, and Deer Park Volunteer Ambulance is doing. And a huge round of applause to Fred Hutch, because without you, without Fred Hutchinson, without your research and your life-saving interventions, people would not be blessed as much as they are.
Thank you so much, Bethany. Thank you for your time, and thank you, viewer audience, for your time. That wraps up our interview today, but I want to remind everyone, stay safe, stay healthy.